Hi, welcome back. I'm Josh with Fishers Health Department here on the afternoon of Tuesday, January 11th, 2022 with our COVID-19 community update. So to start off with a quick recap of what we currently know about the Omicron variant, as you have probably heard in the news and from other trusted resources, the Omicron variant is producing more often, less severe cases of COVID-19. But what we are seeing is that it is highly transmissible. Emerging data indicates that the Omicron variant is 3 times as transmissible as the previously dominant variant, which was Delta. And the most recent data out of the Indiana Department of Health is that 85% of sequenced samples of recent cases are of the Omicron variant. So we are seeing this highly transmissible variant take hold and cause quite a very quick increase in cases. We've seen that massive jump in new cases here locally, but also across the state where we are seeing roughly 9,600 cases a day across the state. And with these higher case numbers that we're seeing here and across the rest of the US, while less severe than previous variants, the Omicron variant is just causing the sheer number of cases to be quite massive. And then you would anticipate proportionally, you will see also an increase in hospitalizations and related severe outcomes from COVID, particularly for those that are at higher risk, just from the sheer volume of new cases and the continued transmission and spread that we're seeing. So what we do know is that the proven vaccines definitely help provide you with that level of protection. Particularly, they are quite effective at protecting you against severe outcomes. So this is significantly lowering the risk for any severe outcomes such as hospitalization or death. Overall, in Indiana, for all time, we've seen that breakthrough cases resulting in hospitalizations are just 0.064% of hospitalizations, and breakthrough deaths, these are individuals that are fully vaccinated, they represent just 0.03% of all COVID-related deaths. Now, in terms of guidance during this high wave, definitely, if you are symptomatic, you should isolate and get tested. If you are asymptomatic and exposed to COVID-19, if you are unvaccinated or not up to date on your vaccines, which includes third doses and booster doses for those that are eligible, so unvaccinated or not up to date, you should quarantine at home for 5 days if you've recently been exposed. So that's 5 days after exposure. And then get tested 5 days after exposure as well. If you have no symptoms at that point, then you are okay to leave your home, but wear a well-fitting mask when around others and in public, and try to avoid high-risk individuals, such as those that are immunocompromised. If at any point during that 10-day window after exposure you develop symptoms, you should isolate immediately and get tested. And then if you're a positive case, irrespective of your vaccine status, if you are confirmed positive for COVID-19, you should plan to isolate at home 10 days after your symptoms start or your positive test. If you have questions on guidance, definitely reach out to us at 317-595-3211. So then to get to our metric areas that we talk about each week, we are seeing that continued rapid increase in test positivity rates and case incidence rates. The Hamilton County unique individual positivity rate was at 24.6% last week, and it is up to 37.1% as of earlier today. The Fishers testing site has increased from last week at 27.1%, and it is up to 39.4%. And the case incidence rate has increased again. This is a 14-day rolling average per 100,000. That is up from 162.6 last week to 249.2. So where we continue to see strain is on testing availability and hospital capacity. We have recently opened up additional hours and created a school-based, school prioritized testing option. So go onto our website if you are a staff, faculty, employee of a Fishers-based school or as parent of a student, you can go online and request an appointment through the dedicated hours and testing options that we have for those individuals on our website. We also are maintaining our All Hoosiers-based portal for everybody to go in and request a test, and that is a PCR test. And then the eligibility criteria set by the state for rapid test are for those that are younger than 19 and over 50. So if you go on and make that state-based appointment and then come to the site, you'll be offered a rapid test if you are eligible. In terms of hospital capacity, we've seen the 7-day average for ICU bed capacity roughly at 7.5% of all the patients in our Indiana Department of Health District 5 that are hospitalized in the ICU. We're seeing roughly 39.6% on average. ICU patients are those with COVID. So do take care. Make sure that you give yourself the level of protection that you can be afforded from these vaccines, and to go out and get your booster and finish your series. If you're immunocompromised, get your third dose. If you have any questions over the vaccines or testing or COVID, please call us 317-595-3211. Thank you and have a wonderful day.